Responsible parenthood. Welcome. Our topic is responsible parenthood. Parenting is a tough job and not everyone is ready for it. Now, the rod and reproof give wisdom, but a child that has no reproof, who gets his own way brings shame to his mother. So it's very important that parents have to be attentive, loving, caring, and other many necessary things they have to do for their children. So first, the meaning of responsible parenthood. Responsible parenthood are parents who do everything in their child's physical and emotional development and well-being. So they love, they care, and then they provide for their children. How to be a responsible parent. Bring them up and nurture them and discipline them in a Christian way. So nurture, parental warmth, that's the degree to which parents are accepting, responsive, and compassionate with their children. Then we have Christian discipline. This talks about parental control, the degree to which parents set limits and enforce rules. That's Christian discipline. Now, it has been found out that when parenting is high in warmth, children are better social and academic skills. They are loving, they are respectful to their parents and other people. Now, numerous studies have shown that children who receive little or no warmth at all become more aggressive and perform poorly in school. This is a fact. Likewise, children who were raised by parents with high degree of parental control as well as low control show depression, more prone to drug use and delinquencies. Parents low in control are either lax, permissive, or uninvolved with their parents. It creates room for laxity. Now, these are needs of children. Children have needs. Sometimes they can be divided into lower needs and upper needs. Now let's look at the lower needs. These are the physical needs of the child. So a few of them include food, water, clothes, shelter. Yes, every child needs these physical things: food, water, clothes, and shelter. So in parenting, a child needs food, water, clothes, and shelter. Then we have what we call the higher needs. These are the psychological aspects of it. The child needs love, esteem, sense of belonging, independence, and communication. So when these things are around the child can perform positively in both academic and social environment. Now, we're going into another topic, which is HIV and other sexually transmitted infection. HIV and other sexually transmitted infections. What is an STI? Well, an STI is a sexually transmitted infection. Some people call them sexually transmitted diseases or STDs, but doctors prefer the word infection because the person may be infected and may potentially infect others, without showing signs of the disease. So we'll go with STI, that is sexually transmitted infection. STIs goes by a lot of names and it can be confusing. HIV is an STI. So are herpes, chlamydia, genital wart, crabs, gonorrhea, and few more others. Another thing is that surprising number of people have or may have had an STI. As 1 in 4 sexually active teenagers have or may have had an STI, that is 25%. So what the STIs have in common? What do they have in common? First of all, STIs are infections that are most often transmitted through sexual contacts. Now, that is when people get an STI, they usually get it through sex. Yes. So second, we now say STIs can cause a variety of symptoms, none of them much fun, including painful urination, bumps, itching, pus. These are the symptoms that comes with sexually transmitted infections. Some people getting an STI may not show any symptoms at all, although there are 20 different STIs that usually come in different ways. One type of STI is parasitic in nature, which means creeping things crawling around you. This includes pubic lice and scabies. Parasitic STIs can be cured, that a doctor can completely get rid of the infection, but they are not fun at all. A second form of STI is bacterial in nature. They include chlamydia, gonorrhea, syphilis. These diseases can be cured, yes, but they can also, like I said, they can be cured. Now, the next one is HIV. They are viral STIs. Okay, they cannot be cured. Viral STIs cannot be cured, but their symptoms can be treated. If you get a viral STI like herpes or HIV, you will have it for the rest of your life. And the rest of your life is a long time and definitely not fun. And thus, it's important to learn how to prevent an STI. Yes. You tell if someone has HIV by looking at them. Many people know. Yeah, now you have to remember that STIs can spread through any kind of sexual contact. It's very important. Then, if you tell if someone has HIV by looking at them. Many people who have the HIV virus do not know they are infected because they do not show any symptoms for many years. So, this is why it's important that people are tested for HIV. There's no cure, but there are medicines which will help an active positive person live long. You can get an HIV. You cannot get HIV from air or food or water or from any animal. Okay, it can easily pass from one person to another through fluids, body fluids, breast milk, and sexual fluids. HIV virus can travel through wounds. This is why it's important to cover up all wounds with plaster. HIV can also pass through medical fluids. Yes, it's very important. Partners that are sexually active should always use condom and protect themselves. HIV can also be passed from mother to child when pregnant or during breastfeeding or during childbirth. Okay, so that is what HIV. What is HIV and AIDS? This red ribbon you see is just a symbol of awareness. Yes, it's used as a symbol of awareness. Okay, to tell us about acquired immunodeficiency syndrome. That's the acronym for AIDS. Acquired immunodeficiency syndrome or human immunodeficiency virus. That is HIV. Okay, HIV leads to AIDS. So AIDS is acquired immunodeficiency syndrome, while HIV is human immunodeficiency syndrome. So this disease, okay, is often seen in people. So let's look at the word syndrome. Is a condition identified by set of related symptoms. So there are a lot of symptoms associated with AIDS. Okay, it's an infectious disease, a collection of different symptoms, typhoid, syphilis, different symptoms will come. Okay, so AIDS is an infectious disease, weaken the immune system, and it has a multiple of infection. So when the immune system of the host person is weak, you can see the person have tuberculosis, typhoid, cholera. All these diseases will come down on the person because the immune system is weak. It cannot fight this virus. It's a very dangerous viral disease that many people suffer from, and the medication they are using is just to suppress it. So HIV is an infectious retrovirus. So what's a retrovirus? What's a retrovirus? Now we see that it's that infection that needs only drugs that can suppress the growth. So infectious retrovirus is just that genetic material that is in the host cell of the patients that have that disease. And as it's there, it's always bringing the immune system down, making the host weak and not being able to do other activities. So it attacks the immune system of the host and it weakens it. That's what the HIV virus does in the cells of the person that has the disease. So AIDS develops in HIV infected people. So whoever that is tested positive for HIV, the next thing AIDS develops in them. So AIDS patients, they are highly susceptible to any disease. So whatever disease that comes, tuberculosis, cholera, typhoid, their immune system loses the capacity to fight off any infection. Okay, so this it's very important that we should know. How does it spread? It spreads only through body fluids. Yes, it spreads through body fluids. Whatever, be it sweat. If there is, it can spread through blood, semen, and placental transmission. So if there is fluid, okay, that is containing this viral disease, it can just go to another person. So through blood, semen, placental transmission, and there is no cure for AIDS. Yes, for the now, there is no cure. It's just the use of an antiretroviral drug. So prevention of HIV, most frequent mode of transmission, okay, is through sexual contact. So avoid unprotected sexual intercourse. Yes, this is the very best way of preventing HIV and AIDS. Not sharing needles. Okay, so it's very important that we should examine all blood transfusion. So before blood is transfused to another patient, it's very important that it's been examined. Okay, we shouldn't use syringes. Syringes that have been used by others cannot, we shouldn't use them because it can transmit AIDS easily. So it can carry AIDS and then transmit to another person that is not infected. So preventing AIDS from mother to child, okay, it's very important that during pregnancy, mothers should be tested so that they don't transmit this infection to their children. Then, even during breastfeeding, it can still be transmitted. Prevention of HIV, we should avoid unprotected sexual intercourse, avoid unexamined blood transfusion, then avoid use syringes and equipment. Okay, how do they diagnose HIV? So most persons go to the hospital. There's what we call exam linked immunosorbent assay ELISA. Okay, so that's how they test for HIV. How do you treat it? Yes, how do you treat HIV? There are drugs known as uh, antiretroviral drugs. These drugs help to control the viral growth of this disease. The HIV drugs helps to bring down the load. So they are known as antiretroviral drugs or therapies. They are known as antiretroviral drugs. Okay, antiretroviral drugs. They are used to suppress the growth of the HIV in every patient. And we have said we shouldn't discriminate against people living with HIV. Thank you so very much for watching and listening. See you soon in the next class. Bye bye. Hope you found this lesson interesting. Be good.